Welcome to Doctor's Desk. Imagine a person coughs in a crowded bus. Tiny droplets float in the air, droplets carrying Mycobacterium tuberculosis, a germ that has lived with humanity for centuries. You inhale it and the bacteria settle in your lungs. Now here's the mystery. The lung is huge, with millions of tiny air sacs. But when TB shows itself again, when it reactivates, it doesn't appear just anywhere. Doctors see the same pattern on all patients like shadows at the apex of the lung. Before that, why the apex? Why not the middle or the base? This isn't a coincidence. For more than 100 years, autopsies and chest x-rays have revealed the truth. TB has a favorite hiding place. The apex is not random, it is chosen. In this video, we'll dive deep into the science behind this strange preference: oxygen tension, blood flow, immune access, and even the way lymphatics drain. You'll see how biology and physics combine to give TB its chosen kingdom, the lung apex. Before we solve why TB loves the apex, let's first understand the germ itself. Mycobacterium tuberculosis is not like most bacteria. Slow, stubborn, and extremely patient. Where other bacteria double in minutes, TB takes almost an entire day to divide. That slowness is its weapon. It hides, it waits, it persists. TB spreads through the air. When inhaled, it lands deep inside the lungs, usually in the lower or middle zones first. But here's the twist: the body reacts quickly. Macrophages rush in, immune cells surround the invaders, and a tiny battleground is formed. This is the granuloma, the body's way of locking TB inside a fortress. For many people, this battle ends here. The TB lies dormant, trapped but not destroyed. Months, years, sometimes decades later, something changes. The immune system weakens, stress, malnutrition, illness, or simply time. And when that balance tips, TB awakens. But interestingly, reactivation almost never happens in the same place it started. Instead, it wakes up in the lung's upper zones, especially the apex. That pattern puzzled scientists for years. Was the bacterium migrating upwards? Was it chance? Or did the apex offer something special? To answer that, we must look not just at TB, but at the lung itself, its structure, its physics, and the tiny differences between top and bottom. 'Cause as we'll see, those differences are what TB exploits. To understand why TB prefers the apex, we need to appreciate how lungs are divided, not just anatomically but physiologically. Anatomically, the right lung has 3 lobes, upper, middle, and lower, while the left has 2 lobes, upper and lower, with the lingula substituting for the middle. Each lobe is subdivided into bronchopulmonary segments, but clinically and physiologically, we think of lungs in zones: the apex, midzone, and base. Now here's where physics steps in. Gravity strongly influences both ventilation and perfusion. Perfusion is greatest at the base, lowest at the apex. Ventilation also increases from apex to base, but not as much as blood flow. This creates a gradient in the ventilation-perfusion ratio. Base, low ventilation perfusion, which means more blood relative to air. Lower alveolar oxygen tension. Apex, high ventilation perfusion, which means more air relative to blood. Higher alveolar oxygen tension. According to West's lung zones, the apex tends to function in zone 1 and 2 physiology, where alveolar pressure can intermittently exceed capillary pressure, limiting blood flow. The base is zone 3, where perfusion is continuous and immune cells arrive efficiently. Now, here's the key connection to TB. Mycobacterium tuberculosis is an obligate aerobe. It needs oxygen to replicate. The apex provides exactly that: higher alveolar PO2 than the base. At the same time, reduced perfusion at the apex means fewer immune cells patrol there. This dual advantage explains why the bacilli don't just survive at the apex, they thrive there. The apex is not merely a passive environment, it's a biologically strategic hideout that supports bacterial metabolism while blunting immune attack. Next factor is lymphatic drainage. Normally, the lungs' lymphatic system works like a cleaning crew, sweeping away debris, antigens, and even bacteria, sending them to lymph nodes where the immune system responds. But at the apex, this clearance is sluggish. The lymph flow is weaker, less effective, and slower to carry material away. That means bacilli that reach the apex are not quickly removed. Instead, they linger. For tuberculosis, this is a golden opportunity, time to replicate quietly and establish a foothold before the immune system can mount a strong response. The last factor is mechanical. The apex of the lung sits under greater negative intrapleural pressure. This stretches the alveoli so they are more distended but less compliant. That mechanical state subtly changes how gases exchange and how immune defenses work locally. The alveoli here are like stretched balloons, harder to expand further, and less efficient at clearing particles. For TB, this creates yet another advantage. Combined with high oxygen, poor blood flow, and sluggish lymphatics, these mechanical differences reinforce the apex as the bacillus's stronghold. It's a unique environment where TB doesn't just survive, it thrives. Now, why does tuberculosis specifically favor the apex? The first reason is oxygen. Mycobacterium tuberculosis is an obligate aerobe. It needs oxygen to survive. The apex, with its higher oxygen tension, provides the perfect fuel for bacterial growth. The second reason is blood flow. The base of the lung is richly perfused, which means immune cells constantly patrol there. The apex, however, receives much less blood, so far fewer defenses arrive. For TB, that makes it a safer zone. The third reason is lymphatic clearance. The base, lymphatics drain efficiently, quickly removing bacilli and antigens, but the apex has sluggish drainage, allowing TB to linger quietly without being noticed. Finally, mechanical factors matter too. The apex sits under greater negative pressure, with alveoli more distended and less compliant. This creates a microenvironment that further favors persistence. And why not the base? 'Cause the base is too well defended. High blood flow, strong immune surveillance, and brisk clearance make it a hostile place for reactivation. The apex, in contrast, offers the perfect balance: oxygen-rich, poorly guarded, and slow to clear invaders. That's why, across time and across patients, TB almost always reactivates at the top of the lung. So yeah, you've just learned why tuberculosis makes the apex of the lung its place. For more fascinating medical insights, make sure to subscribe and stay tuned. This is Doctor's Desk, where medicine meets clarity.